Hi everyone, my name is Mia Harris. I did my flashcard presentation on hypernatremia. Hypernatremia is an abnormal serum sodium level that is greater than 145 milliequivalent per liter. The normal sodium level is 135 to 145. Sodium is one of the body's essential electrolytes, and it is responsible for maintaining extracellular fluid volume in response to osmotic pressure. Sodium makes up about 90% of the extracellular fluids. It is a mineral that carries electrical charges or positively charged ions known as cations when dissolved in water, and it is essential for the conduction of nerve impulses and muscle contraction. Hypernatremia will occur when the sodium level in the extracellular fluid is higher than 145 milliequivalent per liter, which means that the level is higher than the sodium level inside of the cell or the intracellular fluids. When this happens, the cell will lose water to achieve homeostasis or to balance the sodium level in the extracellular fluids. So prolonged hypernatremia will cause the cell to lose water and eventually dry up, which can be manifested with signs and symptoms of dehydration and other clinical complications. Major risk factors for hypernatremia include dysfunction of the kidney. So the primary function of the kidney is to filter and excrete excess fluids and other electrolytes and water from the body. With chronic kidney disease, the kidney is damaged and is unable to regulate sodium and water, which will lead to hypernatremia. Hyperaldosteronism is also another risk factor. Aldosterone is the hormone that is responsible for maintaining the balance of sodium and potassium. So too much production of aldosterone by the adrenal glands will cause the body to retain more sodium and lose potassium. So this can be caused by a tumor on the adrenal glands. Not drinking enough water will also cause hypernatremia because it will cause the water volume to be depleted in the body, which will lead to higher sodium level. Vomiting, diarrhea, and sweating causes the body to lose water as well, which will cause sodium to accumulate inside of the body. Diuretics are drugs that are used to excrete excess water from the body via urination. So people who have congestive heart failures are sometimes prescribed diuretics to help get rid of the excess water, and this could lead to hypernatremia if they lose too much water from the body, which will accumulate the sodium level in the extracellular fluids. Major signs and symptoms of hypernatremia include dehydration of the brain cell and cerebrovascular hemorrhages. So when the sodium level is elevated, the brain cells will shrink, which will lead to petechiae, which is just explosion of the small blood vessels in the brain. This could cause bleeding in the brain, hematomas, and blood clots. Thirst is also a major sign of hypernatremia because when the water volume is low and the sodium level is elevated, the cells will become dehydrated. And then the hypothalamus receptor cells in the brain will sense this situation and will activate the thirst mechanism. Dehydration in general is also a sign of hypernatremia because when the body cells lose water again, this could lead to dry mucous membrane, poor skin turgor or decreased elasticity, and low blood pressure. Central nervous system dysfunction is also a sign of hypernatremia because the high level of sodium will cause the brain cells to shrink as I mentioned earlier, which will lead to neuromuscular excitability and hyperreflex. This could result in confusion, muscle twitching, seizure, coma, and eventually death. Some diagnostic testing that can be done to diagnose hypernatremia includes a comprehensive metabolic panel, which is just a lab that is done to test the levels of electrolytes in the body, including the sodium level. Measurement of the urine output can be done as well in order to measure the urine volume and concentration. So which will tell us, about the sodium level in the body. So this is my presentation, and these are my references. Thank you for listening.